Hello, everyone. Thank you for joining us. My name is Daryl Urbanski, your host as always. And today we are joined by Jim Carlough, Chief Sales Officer at mPulse and a powerhouse in healthcare innovation. With over 10 years leading revenue growth and client success across 300 healthcare orgs, Jim's helped shape over 1 billion annual conversations that improve outcomes and drive engagement. He's led teams at Cognizant, Access Healthcare, and HealthTrio, transforming sales orgs, scaling revenue, and bringing AI-powered digital health solutions to life. Jim's not just a sales leader, he's a strategist, author, and trusted voice in the healthcare space. If you're in healthcare and want measurable results at scale, Jim's the man behind the mission. I've asked him to join us here today to share his story, tell us about his book, The 6 Pillars of Effective Leadership, and share his insights on shaping conversations to improve outcomes. So Jim, thank you so much for joining us. How you doing?
I'm doing great. Thank you for having me. I'm glad to be here. I'm very jealous of the palm trees behind you, but I'm really happy to be here.
And I'm glad that you're here too. And before we get into your book and some of the results you've accomplished, I always like to start off asking, how did you even get into this field? Is this the area that your parents worked in? Are you like second, third generation carrying the torch?
Not at all, which is the very interesting thing. When I went into college, actually, from the time I was 4 years old, I told everybody I was going to be a lawyer. And that came about because in the small town I lived in, the postal workers delivered the mail by walking house to house. And our mailman used to stop at our house and I'd walk with him down through his route. And he'd always want to talk about the future. And he'd always talk about, what do you want to be when you grow up? And I'd say fireman, a policeman, the traditional things. And he said, but really, what do you really want to do? And it eventually this one day got to, I really just want to have a really big desk. And I don't know where that came from, because my father was a carpenter. My mom raised the kids and then worked in a department store. I had no relative that I knew of at the time that actually had a desk. But I said to him, I want to have a big desk. And his response was, you need to be a lawyer. So from the time I was 4 years old till I entered college, I was going to be a lawyer. Go to college, graduate, and realize I have to make money to live. And so I said, how am I going to do that? So I started out in the work world and I actually started working for a health insurance company. And from the moment I got out of college through today, I've been in the healthcare industry. And it has been extremely beneficial to me and our family, and I've been successful, and it's been a great career. It's been a great career.
It's fantastic. And so what? It was just sunshine and rainbows? No, you just picked this avenue and money rained from the sky and everyone sang your praises, and it was just, yeah.
There was work involved. But I did start as a manager and then progress from there. And so it was really an interesting path. So I worked on the insurance side of healthcare, working for insurance companies, probably from 1983 for sure, all the way till 1997, and then made a transition from working on the insurance carrier side to the healthcare technology side. And I spent time both working on the payer side, the health insurance side, as well as the provider side. And so it actually was interesting because it gave me the perspective from both sides of this transaction. Insurance companies want to keep their money and providers want to take their money, right? And so you've got that give and take, and understanding the needs of both put me in a very unique position in terms of being able to understand the complete process. So from that perspective, I probably have an edge on some people because most people stay on one side or the other. They're either on the provider side or on the insurance side.
Was this mostly in the United States or was it international?
While it was mostly the United States, I did work for a technology company and I did have people in Australia. I also worked for a company that was here in the US that was in South Africa in the health insurance business. And so I do have a fair understanding of how insurance or healthcare is delivered in many places around the world.
And the reason why I ask about that is that I wanted to see if you had any insights on the industry. I think right now, like we're in a post-COVID world and people's relationship with the healthcare institutions has changed dramatically. Can you speak to that at all? Like, how do you feel about that?
So it's definitely evolved. Here in the US, if you get admitted to the hospital, the days of your regular primary doctor coming to see you in the hospital are over. The doctor doesn't come to see you in the hospital. The hospital employs doctors to come and take care of you while you're in the hospital. Now, there's good and bad with that. The good is there's doctors there 24 hours a day. The downside of that is they don't really know you. They may have your medical records because the doctor's on the same system as the hospital and they can pull them up, but they still don't know you. They know medically what you've gone through. And so I think there's a little there that when you have something that people aren't sure what you have and they're trying to figure it out, knowing your history and having been with you for a period of time, like my primary care has, there's knowledge that's stored in her brain from interactions with me that that hospitalist doesn't have.
Some stuff just may not even get documented because it doesn't seem like clinically significant, but based on the context, it actually might be wildly relevant. Yeah. Yeah.
So I'll tell you a true story that happened to me. And I haven't told, not many people know this, but I actually had an encephalitis type condition once that was caused from a trip I took for business to Puerto Rico. I had gotten out of the airport to catch a cab to go to the hotel. I know it's going to sound terrible, but a pigeon dropped some things onto my arm that came out of its body.
Right.
And a cab driver saw that, jumped out of his car and said, "Get to the bathroom and wash that off." And I said, "No." And he started to take my bag and I thought he was stealing my bag. He said, "I'm coming with you. I'm not stealing your stuff." He said, "Those birds are sick." And I rushed to the bathroom because he helped me he told me right where it was. And he took me to the bathroom. He even turned the water on, as I recall. And he turned the hot water on and he got me towels and he had me scrub it and wash it a couple of times. And I thought, this guy's crazy. This guy's crazy. So I did business the next day. Within 3 days, I had a fever of 104.5.
Wow. Wow.
Not only did I have that, I had such a major headache and neck ache. I thought I had whatever that sickness is.
Malaria or something?
So I go to the hospital, I go to the emergency room, and I just felt like my head was going to explode. And the doctor came in to examine me and they sent me for an MRI quick. And I said, "Before you send me for that, can you give me something for the pain?" And he could tell I was in agony.
Pain, yeah.
He said, I'm going to give you some morphine. And so he gave me some morphine, which quickly took the edge off of it and made me more comfortable, but it was still there. They determined that I had swelling in the brain, like encephalitis.
Whoa.
And then they did a pap smear.
This isn't what I came here for.
Yeah, that's going to go all over your podcast world. Let's edit that out. But anyway.
Yeah. Next they pull out a jar of leeches. Yeah, sorry.
But they did a spinal tap and it was inconclusive. And I was in for a week.
Wow.
And they had me on IV steroids and a morphine pump. The IV steroids was to reduce the inflammation in my head. And I was on that for 5 days.
Wow.
The fever eventually broke. And they were pumping me with all kinds of stuff. But they eventually figured out, they sent my blood to a lot of places outside of that hospital when they couldn't figure it out. And about 2 weeks after I was discharged, I went for a follow-up with my primary care doctor. And she said, "They determined what you had." And I said, "What did I have?" And she said, "It doesn't really have a name, it has a number." And she said, "It's not very prevalent, but you were infected from that bird. And it caused an encephalitis type condition. And typically, if you're a very old adult," now I was like 38 at the time or under 40. She said, "If you were an elderly adult, you could have died from it."
Wow.
Yeah, it's young children and older adults it can be very serious for them. But in that situation, that doctor didn't have any history on me to know anything. And so my wife actually called my primary care doctor and said, "Hey, can you come and see him?" And she said, "I could, but they don't like me to, but I will gladly talk to the doctor who's treating him. And so
Okay.
she called him and talked to him. And then she called me and called my wife and kept in touch with this guy every day.
Wow. That's
And so she would, which was, and it was only because I think of the relationship, but I've been to her for 20 years, that she went out of her way to do that because she
Mhm.
also was concerned. But yeah, anyway, we digressed way off a topic, but anyway.
No, but that's okay. We were originally talking about, I think that's important because nobody plans to have a health emergency. Nobody plans to have that sort of thing. In life, we all have these lives where we have these perfectly ordered plans and this vision. I'm going to do 5, 10 years. The reality is tomorrow I could step out of my house, get struck by lightning, and all that washes away. They say a healthy man has 1,000 wishes, a sick man has one. And so it speaks to two things. One, it speaks to the importance of health and healthcare, but also speaks to the importance of making meaningful use of the time that you've got. Like people, life is long. I think people say life is short. I think life is long if you use it well.
Wisely, yes. And take care. Ironically, my mom turned 100 last month.
Oh, wow. Happy belated birthday.
She lives by herself in a house, bakes every day, and her secret is I stay active.
Yeah. Yeah.
She reads the newspaper every day, works on the crossword puzzle. I don't know if she ever completes one, but she works on one every day to keep her mind active. And she's an avid reader. And so when I travel, I read. And so I send her the books after I read them. My sister sends her the books after she reads them. And so she doesn't have to buy a single book. She's got a library of books. But yeah, she said staying active is her secret.
Yeah, that's a great analogy. So much is done by movement. If you just took the analogy of a car, if I have a car and it's never going to drive anywhere, then it doesn't need wheels, it doesn't need an axle, doesn't need a drivetrain, doesn't need brakes, doesn't need turn signals, doesn't need lights, doesn't need all this other stuff, right? Doesn't need a steering wheel. And then our bodies are the same way. The whole use it or lose it. And I think that's a really important thing that our brains, creatures in the animal kingdom that don't move have smaller, less developed brains because their lives are less complicated. There's less going on. And I think that goes to speak to people that learn a second language or more, drastically reduced by over half their risk of age-related mental disorders like dementia and Alzheimer's. And it's primarily because it's a muscle. I just think we had Michelangelo and Leonardo, these guys like Leonardo da Vinci, these are people that were sophisticated experts in multiple domains. And now most people can barely pull themselves away from the TV, then they got to get those 4 hours of their show in every day or social media. And I think since I was a teenager, I read Marcus Aurelius's Meditations and I threw out my TV. And since then, I'm 42 now, I've never had a TV. Anytime I live somewhere, there's a TV, I cover it with a blanket, because there's just something about it. It's like this magic box that just sucks your face to it and you can't, and you attach, my phone doesn't vibrate, doesn't ding, doesn't beep, there's no pop-up notifications. There's none of that. It's my tool to engage with the world. It's not there. So some telemarketer can interrupt me when I'm in the middle of deep work. And I think that's a really important thing to mention is that you talk about your mom, like being active, living with intent, doing productive things is really important. Everyone wants to feel like life is all sunshine and rainbows, but the reality is not everything in the jungle kills you and eats you. Some things just feed on you as long as possible. And if you're not careful, like some gazelles need to be eaten by the lions every day. That's just the way the world works. And so if you're not careful, that could be you. But yeah, I digress right now. Let's talk about over the years, you've seen so much happen. Maybe I can ask you to look into your crystal ball into the future. Where do you see the future of the healthcare industry going over the next 5, 10 years?
So I think the challenge in healthcare in the United States is we have to get to where we're more efficient. The process of medicine is very inefficient. I'll give you a real live recent example. I went to the doctor prescribed a prescription. She sent it electronically to the pharmacy. I got a text message from the pharmacy saying, we got a prescription from your doctor. We'll let you know when it's ready. The next message I got from the pharmacy was, we can't process it. We've reached out to your physician. 3 days later, I get a second text message that says, we reached out to your provider. We can't reach your provider. Can you call your provider? So instead of calling my provider, I used their app and I communicated with the office and said, the pharmacy needs to talk to the doctor about the prescription. My assumption was that it wasn't on our formulary and she needed to give them a different prescription. This is 2 weeks ago. I get a response the next day from the receptionist that says, can you call the pharmacy and ask them what the issue is and call us back? And I said, why is that my job?
Yeah.
I'm the customer.
Yeah.
I'm the patient. Now I'm working for the pharmacy and the doctor, and I'm not getting paid by either one of them. So nothing happened until Monday night. I opened the app again, and instead of sending it to the receptionist, I sent it to there were several options. Did you need a referral? None of the options were, do you want the doctor? It was, do you want a referral? Do you have a bill issue, or do you want the receptionist? It was 3 options. And so I said, I want a referral, because I know the referral person is going to be a nurse, a clinical person. So I outlined the whole thing for the clinical person. I said, I'm sitting in the middle of this. They won't tell the pharmacy, you can't get on the phone. I've been to the pharmacy. They want to talk to the doctor, and I'm in the middle. I don't know why I'm in the middle, but I'm 2 weeks and I haven't gotten the prescription. So I get a call from the doctor, and she's agitated that I called the pharmacy, and the issue is they have an over-the-counter version that they think that the insurance company won't pay for what I prescribe. So they want you to take the over-the-counter version. And I was like, is that okay with you? And she said, I don't care what you do. And I was like, I'm just here trying to help the process out.
Yeah.
But that's how inefficient the system is.
Right.
And the pharmacy doesn't have the staff and the patients to make multiple calls. The doctor's phone system is inefficient to get the message to the provider, even though they're connected electronically, and the provider can send the prescription by electronically. The pharmacy can send messages electronically to the provider, but the patient's got to send a message electronically to the physician eventually to get a response.
Right. Yeah. So it's a double-edged sword. So on one, we need to improve efficiency, which means we need more data sharing and more accessing, but then it also infringes on things like privacy, medical privacy. And that's the catch-22. And then there's also perhaps it's an opportunity for an entrepreneur that might be listening to this to create a solution that solves that problem somehow. And I think
the US government's finally looking at it, and CMS has enacted some legislation to improve the electronic transmission of data in healthcare. Now, they did this in 1994, which happened around the HIPAA laws, and it was supposed to standardize everything. But it really didn't standardize everything, because everybody added extra data that they wanted to add to this. CMS is now focused on trying to make healthcare more efficient in a good way. And they're requiring these transactions to be API transactions, but in a server format called FHIR, F-H-I-R, and I can't remember what it stands for. And they've already done 3 of these that have been enacted and mandated and in operation already. And there's 3 more that go live between either 26 or 27. One of which is very important, is electronically processing authorizations between the doctor and the insurance company. Today, authorizations in many cases are paper-driven. The provider has to fax all of the medical records in. The faxes come off the machine, they get scanned. It takes 4 to 7 days to get them in front of a clinician to review.
Yeah.
Think about it. An insurance company doesn't want to pay claims, so if they slow the process down, maybe the provider won't do the procedure, or maybe the patient will say, I'm not going to go through with it because it's taken too long. Now, emergency situations are very different. If you go in with a life-threatening emergency, you're getting care like that. The authorization requirement is off the table, and an insurance company has to reimburse the claim. No questions asked. But if you talk about elective surgery, that's the opportunity for the insurance company to review it, approve it, or put restrictions on how long the patient can stay in the hospital and those things. But by automating this and requiring decisions in 72 hours is far better than 10 days. Because let's say you tore your ACL. or you need your knee replaced, or you had
Yeah,
a bad
my wife did
fracture,
that to our ACL. Yep.
and you're in pain. You want to get on with your life, but you've got to wait 10 days for an authorization to be approved. Then you can't, then you have to wait for the scheduling to have an open in the calendar in order to get admitted and for the surgeon to be available. And a surgeon doesn't typically operate every day. They may operate 2 days a week and do, 10 surgeries each day.
Yep.
So the process is not as efficient as it could be. However, it is far better than it is in other countries where care is more not rationed, but there are less providers to provide the care and the wait times become much longer.
Yeah. It's such a catch-22 on this because there's a lot of things. They say 7 out of the 10 things people die young from are preventable through lifestyle management, proper diet, proper exercise, proper sleep. If you get less than 5 hours sleep a night, they say your risk of all-cause mortality goes up like 400%. And that's just sleep. It's within everyone's power to do. So it's a real catch-22. It's almost, and then there's the demand side where you've got the medical professionals, and to puff them up a little bit, a lot of them are doing their best. And like you mentioned, there's a supply-demand issue. And at some point, how much of your life energy is somebody else entitled to? If you're just trying to show up and provide a service and go home, it's tough. Like you talk about, a lot of healthcare work is not, it's almost like social worker work in the sense that you don't just clock out, go home, and you're fine. Somebody doesn't come in with a small child that just got mangled in a car accident, and you're like, oh, I'm clocking off in 10 minutes, and you just walk out and the kid's screaming, and you're like, let's go get some ice cream. Like that just doesn't happen for a lot of, if you have a soul. So it's a weird catch-22 because there are people where it's like at some point, hey, some of this is years of neglect. Like the whole apple a day keeps a doctor away, and all of a sudden you neglected that for 50 years, and now you're in and then but at the same time you're trying to pay for a service. So it's not an easy, clear-cut scenario per se. I want to spin to asking about then, how do we lead? You've got a book on leadership, and I want to tie that in, but how do we lead knowing that you've got these two polar opposites? Like you said, the payer wants to pay as little as possible and get as much as possible, right? The provider wants to do as little as possible and get paid as much as possible. Each of them wants the other one to be more responsible for themselves and for the process. And we're walking into an era of, we don't know what's going to happen with technology. So how do we effectively lead ourselves through that? Yeah.
So I look at it as a three-legged stool. You've got providers, the insurance, and providers, I lump doctors and hospitals, physical therapists, all of those under providers. You've got providers are hospitals. You've got insurance companies, and you've got the pharmaceutical companies. Every piece of healthcare reform that we've passed in the last 30 years, most all of it has not touched the providers or the pharmaceuticals.
It's all been insurance.
It's only controlled the insurance side of it. The three people have to at some point come together to solve the problem that collectively they're in a position to solve. The government can't run healthcare. The government is incapable of processing a claim.
Yeah.
They may run Medicare, but they don't pay Medicare claim. Insurance companies process them, or an intermediary processes them. The government doesn't own a claim system. And so the government in the United States cannot be at the center or be the single payer for every. However, the government can bring the components of it together instead of trying to deal with them separately. And that's what's happening. This is the last year, or the last 12 months has been the first time the pharmaceutical industry and the pharmacy benefit managers, which are the wholesalers and distributors of the medications, have been to Capitol Hill trying to say why their costs are so high and why we pay such a higher price for pharmaceutical stuff in this country than they charge other countries. But until they get everybody to the same table, it ain't going to get better.
Right.
Now, the transactions are going to get better because technology is going to get better and the government's pushing people that way.
Right.
So government's got the right focus on the technology. And I totally agree with that part of the process, because the technology will also help us solve the fraud, waste, and abuse problem that exists, which is billions and billions of dollars. Yeah, it's billions and billions of dollars. And that causes increased costs for all of us. So attack the electronic side of it, attack the fraud, waste, and abuse side of it, but get the parties to the table and say, look, we're not leaving this room until we figure this out and work together to figure it out.
Have you seen was it life expectancy versus expenditure? You talked about that, and that there's a chart on our world and data. And I love this chart. I actually first discovered it in 2020. And it shows, of course, per capita averages. So life expectancy versus health expenditure. And if you take a look at this chart, I can share my screen, but for those that don't have video, I'll just talk it out. The United States is the most expensive in the world with, at best, middle of the pack performance.
Correct.
At best, middle of the pack. You can pay 30%, which you pay in the United States, and get world leading performance in Japan. Italy, you'll pay 20% and same sort of thing. China is actually got a longer life expectancy than America, I think, right now by 1 or 2 years. And again, coming back to the 6 pillars of effective leadership, if someone listening to this is in the healthcare field, how do they lead their people and lead the industry, so to speak, to try to, like you already spoke to it a bit with the 3 pillars of providers, insurance, and big pharma. Is that what separates us versus other countries though? Like our 3 pillars of those 3 things?
So there's a lot of places around the world where healthcare has always been a government regulated thing. Now, the difference is in the United States, it's mostly employer based, except for Medicare and Medicaid and other government sponsored programs like TRICARE for the military. But if you look at Canada or Europe or United Kingdom, they have very similar systems where all of your hospital-based services are covered by the government. However, you're paying that through your taxes, through your income taxes and payroll taxes. So in the US, where a person might have be in the 20% federal tax bracket, you're double that in Canada, but you're not paying for healthcare. So you'll have insurance in Canada for doctor office visits, but from a hospital perspective, everything that's done in the hospital is paid for through the taxes you pay through your payroll. Just
Right.
like, in the US, you're paying federal income tax. In Canada, you're paying federal income tax, and part of that tax is going to fund healthcare. Same in Europe.
So you're saying that's why the discrepancy, because Americans are paying for it up front versus it being.
No, that's one. But I'm just explaining some of the cost differences, but no, that has nothing to do with life expectancy. But when you look at those models, the models are different. In the Canadian model, you can't just say my knee hurts, I want it scoped.
Okay.
You have to wait and make sure that it's appropriate to have it done.
Yes.
In the US, if you want to have your knee scoped, you can just dial the phone and find a doctor who's going to scope your knee.
Right.
There's nothing wrong with that. It's just a matter of in the United States, we live in an environment where people know that if they want something, they can go and get it. In the United States, the expectation is if I go to the doctor, I'm walking out with what? A prescription. And Americans feel neglected when they walk out without a prescription. I applauded the time when my kids were young and the pediatrician said, your child does not need an antibiotic. Your child does not have a bacterial infection. Your child has a viral infection that can be treated with things over the counter, which was a far cry from when the oldest one first went to the doctor. Immediately it was, we're going to give you an antibiotic, because the parents probably expected that. And that was, but as I've seen, as through my kids have grown, a real transition in the treatment of pediatric illnesses. And it's a positive thing, because over-the-counter stuff is less harmful than long-term use of antibiotic. And you don't want to take them if you don't need them. And if it's only a viral illness, it'll work itself out.
Yeah, the body has an amazing ability to heal. There's also I'm excited to see what happens in the near future. My daughter had an accident and she had to have stitches on her hand. And I remember I was buying aloe vera at the farmer's market. They have that giant aloe vera, and I was slicing out like the meat of it and putting it on and wrapping it. And when I first did that, the doctor thought I was crazy, and he recommended some sort of prescription ointment. it just didn't work. Like the ointment was fine, but the growth was slow. And I was using the aloe vera and wrapping it. And it was almost like day by day, it would evaporate or the skin would absorb the liquid from it. And there'd be a film we peel off and we peel off and there'd be a new layer of skin. Like it was all like there's 3 layers of the epidermis, I think, but let's say like a micro layer was added, right? It wasn't like 3 days, but you could just see such meaningful progress with that. But it wasn't even in the doctor's lexicon. It was like aloe vera. I heard you use that for sunburns, like completely detached from that. So I'm excited to see because I think there's some stuff like that's powerful, but at the same time, it's like a lifeguard versus a swim coach. Sometimes you need a swim coach, but if you're drowning, the swim coach isn't going to help you. You need a lifeguard. You need someone that can jump in and save you and pull you out. So, and especially with translation technology, I'd be really interested because I remember when I lived in Japan, we've had a couple of health emergencies and always paid out of pocket. They didn't seem to have a government system and there didn't seem to be a centralized like hospital to go to. We had to find this. There was like an ear clinic and an eye clinic and a skin clinic and all this specialists. So I'm curious. That's interesting. I wonder how that's how that's going to emerge.
So we have good friends of ours that were just in Germany on vacation and they had an unfortunate car accident.
Oh, I'm sorry to hear that.
And they're perfectly fine, but they were both taken to separate hospitals. The husband stayed one night in the hospital. The wife at another hospital had to stay in for a couple of days. She had a little bit more of injuries in her rib area.
Wow.
But they've started to get their bills. The entire hospital bill for the woman who stayed several days was like $400.
Oh yeah.
Where we start at like $1,200 or more dollars in the US.
I went to Kenya and Uganda. I spent 9 weeks in Africa. I spent 4 weeks in Kenya, 5 weeks in Uganda, and I got malaria on week 3 in Uganda, I think. And at first I thought it was fine. And I was in a rural little village. I was in a rural little town. And people were like, this white boy is sick. I was like puking everywhere. And it felt like all the bones have been pulled out of my body. And I had 2 people help me walk through it. I remember puking in the market. Like we were passing this market. Everyone was like looking. And it wasn't like I was out of place enough. And I get to this clinic and I think I was there for 2 days and put on this IV and given meds to cure my life. And I didn't have traveler's insurance. And I was like, oh my God, I'm going to be paying so much. My girlfriend at the time, she was freaking out. She's like, we're sending you home right now. We're putting you on your plane because she didn't want to be responsible. She lost her mother to malaria. Her mom died from malaria. Oh. She was a young girl. So she was like triggered. And I was in the hospital for 2 days, given a ton of IVs, a lot of doctor's attention. And it cost $21 to save my life with no health insurance.
With no health insurance.
Right. $21. That was it. It cost my life. That was, like I was in rough, bro. I was in rough shape. I tell you, now when I get sick, I'm like, you're not sick. You're a wuss. Like when people are like, oh, I have a cold. I'm sick. I can't work today. I'm like, you don't even know what sickness is. I had fucking malaria like that. You get dengue, malaria. Those are like real sicknesses. But anyways, I'm sorry. I'm on a total rant here. I guess I want to ask you now, what are some of the habits or skills that are going to be most important as we go through this disruptive phase, where these 3 pillars are being upset because of technology, because of geopolitics, because of the change in public perception and education on the topic? So
I think a couple of things have to change. We've lost our way in a lot of areas with regard to integrity and transparency. And one of the things I've learned from mentoring people for the last 30 years is people were put into leadership because they were great individual contributors, and somebody in management thought they were a rising star. And they said, hey, Daryl, we're going to make you a manager. And they didn't give you a roadmap. They didn't give you an outline of the things you needed to learn to do.
Yeah, the Peter Principle.
And you know what? And they don't teach a lot of the soft skills that you need to know. And so to me, my one pillar that I say is non-negotiable is integrity. Because if you can't operate with integrity, your employees will see that because you're not consistent in the way you make decisions or the decisions that you make, which means they're not going to trust you. You can't build a loyal following. Can't build a loyal following when it comes time to show them compassion or empathy. They won't be able to, they won't trust that. And right now, with everything that's coming at them, those are the things employees need most. AI is not going to replace all humans.
No.
AI can't help with detecting whether Daryl's having a bad day, or AI can detect whether Daryl's being productive, but they don't know whether Daryl's child is ill or whatever, or what's causing the decrease in whatever. So you need a human interaction to be able to sense what's going on with Daryl today. He seems a little off. So while I believe there's a big place for AI can't possibly manage the human behavior side of anything. I can't fathom that ever happening. It
Hmm.
can do a lot of things and a lot of good things, and maybe even diagnose medical conditions quicker because of its speed of processing, but it's not gonna replace a doctor who has to make a decision or understand what's really going on with
Hmm.
Daryl,
Hmm.
right? What other things do I have to worry about or deal with? So those are things that I think we're in a state where our leaders need to adopt these principles to be able to lead more effectively and to lead more loyal followers, so that they believe, those followers believe in the bosses or the CEO's decisions,
Mhm.
but especially their vision. And that leads to like transparency.
Hmm.
If now's not the time to hide and not make a decision about AI and say there's so much noise about AI, we're going to wait and see. No, the employees, that doesn't make them feel comfortable. Understanding what you think it's going to impact us with, and saying, hey, Daryl, I don't think this is going to ever impact your job, but here are things I'm looking at or thinking about that may help you work more effectively or efficiently. And I think an employee would be more open to that approach versus thinking that their leader is taking a blind eye to it, while everything in the newspaper is AI this, AI that, or your phone now has AI, or you can do this with AI, because it's all over everywhere. It's
Right.
coming from social media, it's coming from the press, it's coming from the government, coming from everywhere.
I bring this up a lot because I think it's important for people to understand we've been creating tools since the dawn of time. And a lot of people say, oh, we're going to create artificial general intelligence. And that's true, but it doesn't mean it's going to be a sentient, conscious being. And if you look at fertility clinics, there's footage online, you can see the moment of conception when the sperm and the egg meet, because that's what they do. They take the egg out of the woman and some sperm, they put it in a petri dish. There is a flash of light, sometimes multiple flashes of light. And that is the spark. And that for me was, and I talk about this a lot on the podcast, because for me, it was a real shock. It really changed my view, because I grew up in a house of hard science, geology, and applied physics. And it doesn't change. Like, I haven't abandoned all that, but all of science is built on one miracle, which is the Big Bang. And that flash of light, they say, scientists say, and of course they dismiss, this is dismissive, but scientists say it's a release of zinc. Okay, well, you show me how we can release zinc and create sentient conscious life. And then I'll believe that we're going to turn AI into some other thing other than an amazing tool, an incredibly powerful tool. And it could be incredibly destructive. I can have a motorcycle, I can have a car, I can put some rocks and sticks down to hold the brake pedal or the gas pedal down and tie the steering wheel in direction, and I can let it go and it'll just run through a crowd of people and it'll be this destructive, or like a digging machine and it'll just dig to the, and so AI can do the same thing with a different type of work. But we said we were going to replace farmers when the tractor came out. Calculators, spreadsheets. We don't need accountants anymore. QuickBooks. Oh, we're not going to need CPAs. So I don't necessarily buy that we're going to replace humans. I think we're going to have to reskill and upskill people. I hope it'll be. There's also a reevaluation of the new world order, or the world order to a certain extent, which I think will be interesting because, for example, I'm in Southeast Asia right now, and we have two seasons, really hot and really hot while raining. And that's it. There's the two seasons, and there's sun almost all day, every day. And I live in this neighborhood. I got a fancy general that's a next door neighbor. I got all these ambassadors that live around me and other business leaders. Nice neighborhood. We got a guard. It's a gated community with guards and gardeners, landscaping crew. And they go around and they do everyone's yards, and no one is growing food. And I think this is the silliest thing, because I'll see my neighbors once, twice a week. Like, we're all coming back from the grocery store. And in my mind, I'm like, I could have a lemon tree, an apple tree. I could have, like, my yard could just be a giant food forest. And this is just a choice of design. It's a choice. It's choice. We all pay a monthly fee to have these gardeners go around the whole neighborhood. Why can't we turn this into the Garden of Eden? So I think there's things like that where it's not that we lack the technology, it's that the status quo has been comfortable, and why change it? And then there's vested interests in certain areas. And so I think that leadership is going to be really important, and being able to reflect and evaluate our lives, how we've set ourselves up, it's going to be mission critical for ourselves and our kids as we move forward, because sometimes you do things the way you do them because that's how they've always been done. But we have an opportunity here where everyone is now empowered with amazing tools. We're entering an age of abundance, a golden era, where now you could have a PhD in your pocket for any field. And so it's a question of what do you want to create with your time on this life in the world? And that's where people are going to need more leadership skills, because they're going to have more agency over their own lives.
Correct.
So what are some of the biggest mistakes that you think leaders are making?
I think some of the biggest mistakes they're making, besides just not being transparent, is not providing a pathway for their employees. Years ago, organizations typically had leadership development programs for their staffs so that they were always preparing the next level of leadership. I think in many spots in America, not all, there's still a lot of companies that do that, but a lot of them have done away with those programs because they cost money, and everybody gets more focused on the bottom line and the cost of their products to sell and the stock market. Your stock goes down by a few points and everybody's worried, and now the only way to fix it is to cut people. And as opposed to planning, trying to forecast, what do we need to do to be efficient today, and how do we become more efficient and continue to revolutionize the way we deliver our products and services, and at the same time develop our people so that they're ready for the future. I think one of the last things we think about as leaders is how are we preparing the next phase of this? Whereas I think as a leader, my responsibility, number one, is preparing for who's going to replace me. What happens when I decide to retire? To me, I think about that a lot. And so my view, and one of the reasons why I wrote the book, was to help people prepare who wanted to get into leadership with some rock solid things that their companies are probably not teaching them, or because they don't have programs. And things that would not be difficult to implement, but they take time to. Leadership is not, you go to a class and you're a leader. It's an ever evolving position. The way I lead today is different than the way I led when I graduated college in 1983.
Yeah.
Now, all of your listeners are now calculating how old I am, but the reality is it's different. In 1983, it was very authoritarian, much like military style. The leader told you what you needed to do today. Then you come in the next day, leader told you what you needed to do that day. Today, you can't do that. A, you don't have the time to do it. B, people are smarter and more educated. C, we have too much we have to do. And so a leader has to stay focused and has to stay motivating and be the cheerleader while preparing people for the future and helping them get through the struggles of the day to day. And being there for them and being there in the moment, and be able to be an active listener.
I love that. I agree wholeheartedly. To me, leadership is self-awareness skills, communication and cooperation skills, emotional intelligence, adaptability. And there's certain personality traits. You don't have to be an extrovert person. You can be introvert, but to lead, you have to be able to flip an extrovert switch at the appropriate time. Like we're social animals. You and I exist for the purpose of cooperation with each other. That's why people get sick and have all sorts of issues when they're isolated too long. We exist like your hand-eye foot coordination. Like we are designed in here to cooperate with each other. And so that requires a certain amount of extroversion and a certain amount of agreeableness and conscientiousness. And I think that all ties into leadership, like you're saying. And so integrity, trustworthiness, transparency, those are mission critical. And I think you need to have a commitment to the mission and understanding of yourself and others. I think that's really powerful. Really powerful.
Totally agree. Totally agree.
So Jim, this has been a great call. I've got a page of notes here. People may want to listen to this more than once to make sure they got all the goods out of it. Is there anything I haven't asked you about that I should have asked you about?
Probably, but we could always do that on another call. I think what I'd like to do is ask your audience to give us feedback and what would they like to hear the next time we get together. This was very interesting. This was a very interesting and energizing conversation that I'm sure they could tell is not scripted and was very natural. And these are the types of opportunities we have to educate people and bring knowledge to them. And so I would like to hear from them either through your podcast and your commentary channel, or they can find me on social media and comment as well.
Yeah.
But I would be interested in that. And what would they like to see us cover next time we come together? I think maybe we're creating our own podcast team here. I'm just kidding.
No, I love it. If you guys want to get in touch, go to jimcarlough.com, JimCarlough.com. You can also look him up on social media if you want. His LinkedIn is the same, Jim Carlough. If it's him, if he's based in Dallas, Fort Worth. And again, the website is jimcarlough.com, JimCarlough.com. Reach out, let him know what you thought about the interview. Jim, it's been an honor and a pleasure. I really appreciate you taking the time to share with the audience and I, knowing that you've got your own direct reports, your own children, your own family, your own projects to take care of. Thank you for coming and sharing with all of us so we can all do a little bit better.
Daryl, it's been a pleasure. Be well, my friend. I hope to talk to you soon.